This is probably one of the big successes in Bangladesh. With these initiatives, we have been able to successfully introduce verbal autopsy, which is generating a plausible cause of death for most of the community death. It's a real success in Bangladesh.
Before introducing verbal autopsy and MCCU reform in our hospital, very little information we are getting from our community and hospitals that who is dying from what, which is very necessary for implementing policies from the national level. But after introducing the verbal autopsy, now we know that cause of death is very important for us.
The highest authority of our country, that is Cabinet Division, they can support us these activities in Bangladesh.
I think the government of Bangladesh and the Data for Health are working together, and they decided to implement the intervention by phase in different areas of the countries. There was around 80 to 85% deaths are occurring in the community, and for them there was no system to get the cause of death for this huge population in Bangladesh.
And after introducing verbal autopsy in 13 Upazila, like the province in the other countries, the tremendous improvement has done.
The Upazila is a administrative unit of the Bangladesh. It is just below the districts. Sometimes it is called sub-district or Upazila. Having an average population of one Upazila is 300,000.
We conduct 595 verbal autopsy total data. It's a big data, at least 2 years. I think our data quality is good.
And in our countries, the infectious disease get the priority because they are notified better than the other non-communicable diseases. The majority of the diseases are found that these are actually non-communicable disease, and that should be preventable by modifying the lifestyle. And government shouldn't aware about that before. That's the main success of verbal autopsy, that we have bring out some other diseases like government was totally unaware.
We have linked the death registration with verbal autopsies. So as we are doing more and more verbal autopsies, the completeness of the death, both for the death registration as well as for verbal autopsy, is equally increasing in the interventions area.
It's totally a very intelligent program. It generates the cause of death from the algorithm, which is automatic, and in our country where exactly cause of death is not known. So it's like jumping to the rocket and goes into another planet to get the cause of death, and that's the light bulb moment. In many other countries, maybe they didn't heard about the verbal autopsy, and we are from nowhere going into the verbal autopsy and getting the cause of death by computer algorithm, and I think that's the light bulb moment for our country.
This is the first time we have introduced a active identification of the death through the community health workers. They are visiting routinely the households. Now they are doing extra work for identification of the birth and death, or helping the families for information to notify into the local registry office. Community identification of the death cases by the community health worker has increased tremendously the coverage of the death registration in our community. It was around 7% or below, but now it is around 70-80%. In some sub-districts, it is more than 90%. So this is a miracle, I would say. It may take 20 years to improve or to increase the coverage by such a high range of coverage. This is also a very new data they have got, and they have found a good model, which model they appropriate for Bangladesh to introduce to increase the coverage of death or birth registrations. So Bangladesh was losing cause of death for most of the death occurring in the hospitals. Bangladesh was using a non-standard death certificates, and the government reviewed the new certificate as well as the old certificate and decided to introduce the new international forum death certificates. The quality, reliability of the data sometimes rely on the instrument, trainings, and the standard procedure we have used to generate the cause of death. So with all this process in place now, so the data now generating from our D4 activities will have a reliable and valid cause of death for Bangladesh. We have introduced the appropriate coding studies. We have revised our reporting registration certificates. We have introduced the standard training activities. So all this probably contributing a reliable data for Bangladesh. We have customized our DSSI to district health information software to store the data generated by the VA verbal autopsy as well as the MCC data for quick reporting and visualization of the data in the DSS2 dashboards. We have reviewed the CRBS system in general, and also it is under process now. So this is the first time we are generating community level cause of death for huge populations. We have a CRBS committee, interagency CRBS committee headed by cabinet divisions, and all the stakeholders, at least I would say the Ministry of Health played the major role along with the local government, basically is maintaining the civil registration database, and the CRBS Secretariat and the local administrative unit. They are working together to make it possible. We are also in the process to involve the Bureau of Statistics, the Central Statistical Associations. Very soon it will be possible to generate population level statistics by the Bureau of Statistics in Bangladesh. So everybody is contributing in the D4 supported activity to make a success story in Bangladesh.